Hi, everyone. Good evening or afternoon, I should say, and welcome to the C4 Solutions webinar. I'm going to tell you a little about myself before we start, but one thing I will mention is whenever you work online, you always have to be aware of technical problems. For example, I could be in the middle of this PowerPoint presentation and webinar, and it could just go for just a lack of electricity for even a second, the whole thing drops. So I've made arrangement with C4 Solutions IT man to have the PowerPoint at his home or his office, and I have a phone number I can call in. So if I were to disappear all of a sudden, that meant we have an electricity problem, and he would keep the slides going and I would just come back talking in. That's the very important thing to mention. The other important thing, if you have a dog, I have a dog, and he's probably going to get jealous and try and come up on me, or you may hear him bark. So those are the two technical problems I usually deal with. I'll start out by telling you a little about myself, for those of you who don't know. As you can already hear, I'm from New York, which has certain advantages, especially when you want to be very quick. Everything in New York is very quick. If you want to ask your friend if he's eaten yet, you say, "Cheat yet." Or you want to say, "Let's go," you just say, "Go." You can say, "Let's go, let's go." So there's awesome advantages in living in New York. Anyways, I went to NYU, studied psychology. My professor at that time was Philip Zimbardo, who you may remember from the Stanford prison sentences and experiments he did out there. He was very inspirational, and I became interested in psychology. Living in New York, I didn't know there were trees other than in Central Park until I was about 12 years old. At 21, I took a job in Connecticut in the school system, and I did my master's in psychology and counseling at University of Bridgeport in Connecticut. And then I moved to Maine, which I love the rural living, as you'll see in my career. And I worked in the school system. And I took my doctorate at Oregon State, another beautiful state, Oregon, and in psychology counseling. And then I ran into affirmative action. So since I wasn't a minority or a person of color, or I didn't want to claim to be Native American like some people do, I decided to take a position at the University of Haifa in Israel in the Psychological Counseling Center. And I took a position also at the Child and Family Clinic of the Kibbutz movement. It's a large clinic that served the entire north of Israel. That was the beginning of my career in Israel. In 1987, I got into recovery here in Israel, and being the only professional in the treatment field as a therapist, the only therapist with a PhD in the country who was also in recovery, I was contacted with several people to help start up Israel's first 12-step treatment programs. I was clinical director of the first one and clinical director of the second one, which is now one of the largest rehab programs in the country. It's called Haderech, which means the way, and it's up north, and it's government sponsored. I also opened a private practice treating addictions in food and gambling in particular. I was one of the first professionals in Israel to talk about food addiction, bulimia, overeating as an addiction. I was inducted into the Israeli army. I served as a mental health officer treating what they call combat reactions or trauma, PTSD. And I had a contract with the Ministry of Defense to treat victims of terrorism, which were mostly care workers from the Philippines who were on buses that were hit by terrorists. In 2005, I went to Ridgeview Institute in Georgia, took a position in the Recovering Professionals program between 2005 and 2011. And in 2008, this is relevant, I got a Skype call from my son, who was in Europe. We were talking, he said, "Hey, his brother, my youngest son, is in South America." And he got on the Skype call. Excuse me. So I'm sitting there watching two of my sons and talking to them just as they're right next to me. You know, "How are you? You're in Colombia, don't do drugs. Well, how's the money situation? Love you guys." Closed it out. And I sat back and I said, "My goodness." I said, "This is amazing." I said, "This is going to be the technology of the future in therapy." So I started doing individual therapy, and finally I got into group therapy in 2011. And at that time, the hospitals in the States were afraid to touch online therapy because of the insurance. When I was contacted, I have a friend at the Anti-Drug Authority here in Israel. he suggested we do it here. He said, I want that. So for the next 6-7 years, I did continuing care groups for Israel's recovering addicts. And they came on in eight of them in a picture, each having their own window, from the north of Israel to the south in Eilat. From here, I also worked with Hope Homes Recovery, sober living facilities, and they're in the south in the United States, in Atlanta, Charlotte, and Nashville. We had a continuing care group online, which was interesting. And then now I'm working with the municipality of Jerusalem. They have I'll share the app later. It's a program, a chat program for kids in crisis in the Jerusalem area. And we have a staff, and I do the supervision of it. It's very interesting. I'll tell you about that a little bit later. I've done a lot of research and a lot of presentations, both nationally and internationally. And here comes my dog. And if you want to read some about what I've been doing, you can go to my website. This is my little dog. He has to come up all the time. He's got to be involved with everything I do online. Oh, another thing I will mention to you, which is funny. He's from Israel, so he speaks Hebrew. And the word for enough, you say stop, enough, is die. And I was in Smyrna, Georgia with him, and he was pulling on the cord, on the leash, and I yelled, die. And the people around me, they looked at me like I was some kind of crazy, sadistic guy yelling for his dog to die. In any case, let's get started, okay? As an introduction, you know that we all use the internet daily. We've been using it for years. I have an app now that can actually deposit checks, checks, by photographing them into my bank account. It's amazing. Telephone hotlines have been around for years, addressing specific problems. We had battered women, suicide preventions, adolescents in crisis, pregnancy, AIDS hotlines. And now it's going on the internet. It's not a new idea. It can be email, chat room, individual or group therapy conference. I like the group therapy, allows all the group members to see and interact with one another. And people talk about the technology today, say it's not good, people are getting addicted, it's making us antisocial. Well, it's a fact, it's a technology, and I don't know what the changes are going to bring, but the same thing with the newspaper. Kids today go outside to play. That's how they do it. Not all of them, but a lot of time is spent on the cell phones, on the smart apps. This is an amazing picture of someone who's going. This person's called a digital native. He was born into the digital culture. I'm a digital immigrant, okay? And I show you, everyone's taking pictures. Unfortunately, sometimes they shouldn't be taking pictures, but you see on the news all the time, crime prevention. You always see fights that break out on the news. Someone's always taking a picture instead of getting involved. This is what the tans of the next generation is going to look like, folks. Now, I don't want to be talking down, but I want to show you an example. This is my oldest son on the left and my youngest son on the right. When my oldest son's baby was born, we're in the hospital room. They're very happy. And I'm sitting opposite them with my other son. My wife took this picture. What can you do? It's part of our lives, whether we like it or not. And the kids are the ones who are really, really up on the technology. Whenever I have a problem, I just call my son. Helps me right out. If you look at the world populations, the internet is right up there. Special programs like Facebook and WhatsApp and LinkedIn and Twitter. They're as big as China, India, and other countries. It's part of our new technology. The world is coming around. Now, terminology for online therapy. I like online therapy or internet therapy, telemental health. These are some of the terminologies that we use for online treatment. Here's some of the advantages. I don't know if you remember the movie Ordinary People. The young man was having a tremendous catharsis. He called his psychiatrist, said, I got to talk to you. He said, I'll meet you in my office in 45 minutes. I think that's what he said, an hour or 45 minutes. Well, you see, with the internet, We can, if you called me and said, I got to talk to you right now, I said, I'll be with you in 2 minutes. Go to my website, click on enter meeting. That's how, one of the advantages. It eliminates travel, and no sessions are delayed because of weather or traffic jams. When I was in Atlanta, we had 2 days of an ice storm. The hospital was closed. The NA meetings, AA meetings, all the support meetings were closed out. My meeting went on online. People were sitting in their warm homes and we talked. Now, special needs people who live in, or people that live with special needs, special challenges, it's easy for them to get online. And those who live in remote outlying areas. So if I'm in Georgia and I want to talk to Dr. James Craig, who's up in Ely, Georgia, or Ellie, I forget how you say it. I think it's Eli. Anyhow, it's a good hour and a half out of town, so I can save time if he were to go online. And people who have time and travel restrictions, professionals who can't take the time to leave the hospital or the law or practice, whatever, pilots who are traveling around the country can go to therapy in a hotel room on a secure connection. And single parents, they don't have to hire a babysitter and then travel and come back. Now, I will tell you something from my own experience. Someone might want to do a research on this. No matter whatever single parents tell their children, during the session, you'll always see a kid running by behind the mother waving. He's got to be in the movie, in the film, in the clip. Other advantages, a therapist who has a specialty, people can receive treatment from all over the state or from all over the world for that matter. So if someone lives in Maine and there's a specialist in, say, Portland, and he lives up in Aroostook County, which is 110, 150 miles away, he doesn't have to travel to that specialist. It also allows anonymity. Okay, the person, no one sees them going in and out of a building. I remember at Ridgeview, we had a professionals building next door to the hospital, and some of my professionals were uptight about walking in because people would see they're in recovery or they had an emotional difficulty. So internet has an advantage of providing anonymity. Lower cost for the patient. You know, I was doing groups for $60 for 4 sessions. You can't beat that, okay? Simply because we have lower costs without operational expenses like office rents and all the utilities, insurance on the office and heating and air conditioning, whatever. And we can better utilize our time. For example, if I have an appointment right now and the patient were to call me and say, listen, I'm stuck in traffic, I had a breakdown of the car, my mother's sick, whatever, I can't make the appointment. No problem. I just say, okay, give me a time for tomorrow, we'll meet you tomorrow. And then I just close out the program and read the news or check my emails or take the dog for a walk. I don't lose anything. If I were to go into a clinic, it's the time and all the effort I have to put in. Then we do have a policy. We usually charge 24 hours in advance or whatever. You don't have to do that with the internet. We also, as a specialist, you have the ability to have an increased client pool. Because if you're a specialist in gambling, people from all over the area can come to you. They don't have to settle for whatever persons in their local area who may not be as good. Now, some disadvantage, the patients have to have some technological skills and use of the computer and internet. This is a true story. I was doing a group, and one of the women in the group, her video was always lagging, and there was a problem with lip synchronization. I said to her, are you, you're not connected to the router directly, are you? She said, no. I said, are you near the router? She said, I don't know. I said, why don't you know? She says, it's at my neighbor's house. So she was on her neighbor's internet, which was pretty far away. And that was the problem. You have a slightly limited view of the patient's position and movements. For example, you can't see my feet, okay? You may say to me, how are you feeling today, Arthur? And I'll say, well, I feel very relaxed, and my foot is going like this, but you don't see it. Another disadvantage, you can't touch the client. You can't take pillows and have them hit the pillows and work out some anger. And you can't give hugs. Although I did have an incident which was, as soon as the person came on, I saw something terrible happen. I said, what happened? He told me his father had passed away, and I knew his father. I felt very bad. I said, geez, you know, if we were in my office, I'd give you a hug. He said, yeah, I know. I said, well, let me give you a virtual hug. And I leaned close like this, And he smiled, you know. But those are some of the definite problems with the limited. During one group, a doctor got up and she went to the door. When she got up, we all noticed she was wearing pajama bottoms. She went to let the cat out. And I said, "Hey, are you wearing pajama bottoms?" She said, "Yeah, but I had to let the cat out." That's an advantage also. You can wear bedroom slippers or barefoot or short pants and put on a tie and jacket, look like you're a real professional. In any case, some people have limitations of connection with the speed of the internet. And also, when they're online, they have to realize that they can't have a wife upstairs downloading a program that reassigns furniture in the house, or they're watching a movie because that's going to take up a lot of bandwidth. Those are some of the technical problems. Now, it's still in the development. Of course, it's in the developmental stage, but it usually requires a mic, an earphone and mic. Now, it doesn't always, the new programs don't always require that, but sometimes they do, and I don't know why. It's still best to have it also doesn't let the people around you hear what's going on. I assume you're in a secure place, but you know, nothing comes out of speakers, and it allows for perfect lip synchronization. Now, I'm going to show you some research. I want to get through this quickly because I really want to get to the apps that are going on today. But summarization, these are some of the benefits of working online, as we mentioned. This is very important. Clients seem to be very satisfied, more satisfied than we are satisfied. In the beginning, I was very nervous and uptight, wondering about the technology, and they were very relaxed and enjoying the benefits of working online. Less travel time, we talked about savings in child and travel costs, access to remote areas, greater access to specialists, no loss in productivity or income, and what we call continuing care support. I'm going to go through the research rather quickly, but I just want to reinforce those points. Video conference is used in a variety of approaches with diverse populations. It's comparable to other clinical outcomes with face-to-face, and the most important thing, user satisfaction. We had a program where people were divided into online versus in-person care and equal rates of recovery. These from people in opioid abuse disorder recovery, and the online care costs 10% less. Another study where they took 37 persons addicted and live or in-person care. Again, equal rates of recovery, and this is interesting, the patients require or preferred the online care. The biggest organization I know of using the internet is the Veterans Affairs Department of Veterans Affairs, and they're not restricted by state borders. They travel all through the different parts of the United States. They report, and they have a huge sample here of almost 100,000 veterans, 25% fewer hospitalizations, and 25% shorter hospitalization. And this was a 4-year study. It's used, again, this is a veterans program. 133 patients received outreach on telemedicine versus the usual care, and they concluded it's evidence-based in treating post-traumatic stress disorder. I'm moving fast because there's a lot on these slides, and I want to get to what I think would be most important and most enjoyable for you. The effectiveness, it's also used for diagnosis and assessment and for disorders, and it's comparable again to in-person care. Children seem to like the novelty of the interaction and the authenticity of family interactions on the internet. These additional findings, again, comparable. It's effective for cognitive behavioral therapy with anxiety, depression, insomnia, pain, anxiety, operational defiant disorder, and ADHD. Again, the last one, Curtin University, video conferencing can be a highly effective and accessible means of delivering psychotherapy. Lowering costs, the same thing we've gone over and over. Various distinct advantages, convenience. Okay, this summarizes it all. A survey of 123 studies. Online counseling can have a similar impact and is capable of replicating the facilitative conditions as in the face-to-face encounter. Okay, I mean, you're seeing me. I could be sitting right next to you. If you had a big picture of me instead of a little one, you could talk to me as if you were sitting opposite me. Telemedicine, been using it for web-based screening, web-based treatment, video conferencing, smartphone apps. We'll get to those. They say it has a great potential for treatment for people in recovery from substance abuse disorder. Here's a bibliography that you can make note of, give you a lot of information about what therapeutic tools are available and health comparisons about the different programs. So I'll give you a moment to write that down. I will be giving you some other websites that you can get a lot of free and good information. So if you, the easiest thing to remember, if you have it written down, telementalhealthcomparisons.com. Now, unexpected problems, okay? You're gonna have that in most professions, but we're based on technology, so we're gonna have problems. This hasn't happened to me, but my dog did disconnect my microphone by dragging his toy across the cable, which was going on the floor. But you never know what can happen physically to knock out your internet. Now, this happened to me once while I was in a group. It actually happened to me. This is not the exact slide that I saw, but all of a sudden I'm in a group and I'm out of the group and it says, Windows is shutting down and updating your security clearances. I didn't know what to do. I said, okay, well, in another minute or two, I'll go back in. That's okay. I just start up again and go back in. So the computer started up, and this is what I see. 10%, 20%. Took me quite a while to get back in. By the way, when I got back in, the group was joking. We didn't need you. Great for my ego. Okay, we're not the only one to have problems, but this is a common one. What do you do when you have no image available on one of your clients, and you'll lose the session, or you can't take the time out from the group to fix that? In the beginning, and I'm going to recommend a lot of programs. I have no financial connection to them. In the beginning, I used a program called Mega Meeting. It's HIPAA compliant. It's encrypted at both ends. We'll talk about HIPAA later, but the greatest thing about them is that they have internet, they have telephone support, free telephone support 24/7. So when I was in Israel doing a group at 8 o'clock on the East Coast, it was 3 in the morning, I could call and get help. And I could also say to a client, call, I can chat to him or tell him, call this number, press number 2, and tell him what the problem is and he'll fix it. The great thing about working with Mega Meeting in the beginning was I had so many technical problems that I kept calling them, and then I learned from what they were doing how to solve them myself. I'll give you an example. One day I moved close to the desk and I moved back, and all of a sudden the group's yelling at me. They can't hear me. There was a mute button on my cord, and I had pressed it between my desk and the stomach, and I muted myself. Well, I'm an expert. I run right to the control panel, sounds, make sure my earphones are default and everything. And I can't figure it out. I said to the group, just a minute. I called Mega Meeting support. He tells me, do you have a mute button? Oh, solve the problem. So I would recommend those of you starting out, that's a good option. Another thing I want to say is you don't want to have a program we have long downloads. The nice advantage of Mega Meeting is that it's browser-based. You meet the client on their secure website, so there's no downloads. I was trying out a program, I'm not going to mention the name in the beginning, and I tried out several of them, and after one session, it said, pops up, such and such company is leaving cookies on your internet, on your computer. So I thought, no, I didn't like that. Plus, there are a lot of people I'm working with who would definitely be paranoid about having something left on their computer. This is a wonderful thing. Please contact support. Very important in the beginning. A lot of programs offer 9 to 5 support, but if you work at 6, 7 in the evening, you have to email them and you lose the client. I once had a client from England who, the first time she was using the internet on a tablet, and I had no idea about the tablet, how it works in the program, because I was using a computer or a laptop. And she couldn't get in, so I Skype called Mega Meeting support and put her in on the conversation. They got her in right away. which saved me losing a client on a first session. So the technical support, very important. Now, we're not, as I said, we're not the only one, our profession having, what is this now? I don't want that. Sorry about that. Other professions have unexpected problems too. Okay, now I'm going to touch on the laws, but I suggest they're updated regularly and pretty quickly. I would suggest one of the resources is the American Psychological Association. They have listing the 50 state requirements for telemental health. In the United States, basically, you have to be licensed in the state where the client is located. Whereas in Europe, therapy takes place where the therapist is. So if I'm a Greek psychiatrist, I can treat someone in England or in Serbia without another license. It's a terrible thing, by the way, and I think it's going to change. In fact, there's already something called the Psych Compact, where 7 states have agreed to issue an e-pass through states. So it's complicated. I think it's terrible that we can't practice throughout the United States, and it's going to come apart at some point. This is the best resource for all the legal aspects by profession. Now, it's not a black and white situation. There are some states that will allow you to practice in their state on a what do they call it? Provisional license or provisional time limit, 30 days of a year, the first year. So that gives you a day being even an hour. That gives you, if you have a client that moves to a different state, in some states, you can see that person for 30 times that year or every other week. So I would look at Epstein, Becker, and Green. They have the most thorough delineation of all the laws for counselors, psychologists, all types of treatment providers. Okay, I've got a very short clip about security I want to show you right now. Coming up. Come on. Okay. That's just to give you an idea how quickly information can be stolen. In a matter of seconds, it can be taken off. And I'm going to be talking about HIPAA compliance. You'd be surprised what's going on today. Just today in the New York Times, I read about public schools where they don't have really good cybersecurity personnel or programs. They're getting hacked. Public schools in Syracuse, New York, Louisiana, and Texas. And you all heard about Baltimore being hacked. We'll talk about it in a moment. In the United States, we have the Health Insurance Portability and Accountability Act, and we need to protect personal health information. Present, past, or future physical or mental condition of a patient. That's in terms of medical information, that's also any medical information. Now, whether or not you need to be HIPAA compliant is a matter of discussion. If you're a healthcare provider that conducts certain transactions in electronic form, you are therefore what's called a covered entity. Then you have to be covered. If you do certain transactions, we'll talk about those in a second. It includes doctors, clinics, psychologists, nursing homes, pharmacies. They all, if they transmit electronic information. Okay, if you are a covered entity, you have to comply. I found it's debatable whether I'm a covered entity, but I have decided to comply. It's no big problem. I'll tell you about that in a moment. If your practice has never billed insurance and you're not storing data on your computer, you're probably not a HIPAA covered entity. It's the conduit rule that determines this. This means, the last sentence, this means as long as the signal is encrypted and cannot be unencrypted by the software company and not recorded or stored, it should be fine to use. So if that's all you're doing, you don't need to be HIPAA compliant. I'm not an expert on all these different things, state laws and HIPAA. If you want a resource, there's a website called Person Centered Tech, personcenteredtech.com. There's a guy named Roy Huggins. He's one of the country's experts on all, and you can get a lot of free information, lots of articles he's written. And this guy, I don't know how he has time to sleep or eat. He's been covering it so thoroughly. I'd recommend it. Person-Centered Tech, Roy Huggins. This is simply Department of Health Services, the government's graph. Does the person, business, or agency furnish, bill, or receive for health care in the normal course of business? If the answer is no, you're not a covered health provider. If the answer is yes, does the person, business, or agency transmit any covered electronic transactions? Covered meaning stored or in memory. Now, if you're working, I have a questionnaire on my website, which is stored by a site called Enhanced Web Services. It's in their computer, in their protection. I can only access this by a password. I need to have what they call a business associate agreement with them to be HIPAA compliant. That says that if they have a breach, they notify the government. If they have, and they agree to do everything. In fact, they have to be equal to what I'm doing in terms of security. Very important to get a business. For example, a nursing home didn't have a business associate agreement. They were fined $650,000 because they didn't have a business associates agreement. You can see what's going on. Mostly large corporations. Massachusetts got a fine, South Shore Hospital, $750,000 because they lost a backup tape, okay? One company in Vermont did not notify immediately about a breach of information, and they were fined $55,000. If you lose a laptop, okay, the bottom, Massachusetts 214, $100,000 fine for Beth Israel Deaconess Medical Center for laptop theft. Okay, one of the interesting ones in Indiana, a dentist dumped his medical records. He was fined $12,000. Oregon Health and Science University, $2.7 million. This is interesting. Just notice, Riley Orthopedic Clinic gave all its x-rays to a guy or a company that was going to put them on electronic form and destroy the x-rays and keep the silver content in the, but they didn't have a business associate agreement. So the clinic had to pay $750,000. Chances of one of us individual practitioners being monitored, slight, but safety is best, be sure. What's the word? I forgot the expression. Safety is the best policy, I guess. It's very easy to be HIPAA compliant. I have a business associate agreement with my video conference program and a business associate agreement with my questionnaire. Ransomware. Now, this is a real big problem. You might have heard just recently, city of Baltimore got hacked, the whole city. And they paid the ransom. And Colorado Allergy Clinic was attacked. They usually get in through emails. There was just this week, I got the HIPAA email. The American Medical Collection Agency, okay? They're the ones that take all the debt. They collect debt from many different laboratories around the country. 2.2 million of their files were hacked. 2.2 million. That includes diagnoses, birth date, name, social security number, credit card numbers, all that. Just this week. And that includes like some of the biggest corporations in testing, which we worked with at Ridgeview. Quest Diagnostics, 11.9 million files were taken. And also LabCorp, banking information. Ransomware has increased during the second quarter of this year by 184%. The average ransom payment was $12,762. In the second quarter, $36,000 plus. And it's not just the ransomware. Some people don't want to give the ransomware, but the time and money they spend trying to get back online, it may take 4 or 5 days with the whole operation shut down. There's quite a bit of, phishing attacks, which means they send an email or a phony thing and you click on it. I almost get trapped in these all the time. I get emails from FedEx, Wise Health System in Decatur. This just this week, 35,000 patients. St. Croix Hospital in Midwest, 24,400. 25,000 in Adirondack Health, Vermont. 13,000 in Penobscot Health Center in Penobscot, Bangor, Maine. So you see there's a lot of this going on. What happens is you click on something. Don't click on anything if you don't know it. Even if it's from a friend, it looks suspicious. This is what you see on your computer. You can't get anything. You can't get your pictures. You can't get your emails. Nothing. You can't get anything. There's another one, and you have to make the payments in Bitcoin. Incidentally, 96% of the ransom that's paid, they get their files back. 4%, they don't get their files back. So these are things you have to consider. It's another one. This is the one that took out Baltimore. Can you imagine getting up and having everything on your computer inaccessible to you? Huh? Now, so they try and prevent hacking. So they put the computers, I'm talking about big computers in centers of corporations, they air gap them. They don't put them against the wall so someone can listen to the computer or click into it. And then some guy figured out how to get through the speakers. So they take the speakers off. They have what they called air-gapped computers without speakers. But some guys come around from the University of the Negev in Israel, and they came up with what they call fan smitter. From a telephone, because the fans in the computer are running all the time to keep it cool. They figured out the RPMs of the fan. They can hook into that somehow and then hack the computer. This was Cornell University covering it. Acoustic data infiltration from speakerless air-gapped computers. So you really need to be worried today about what's going on. This is something I just found out. I'm going to show you a 1-minute clip, and you're not going to believe it can be done. Take a look at this. That's my neighbor's dog barking. My dog's ready to bark. Come on. Come on up. Here you go.
The attacker starts by executing the exploit script and instructing it to target the victim's fax number, as seen here on the attacker's screen. Using his exploit script, the attacker can now send his malicious fax to the victim's all-in-one printer fax machine. On the left screen, you can now see the fax is being received by the victim and is sent for printing. To illustrate the attacker's control over its target, our exploit displays our chosen image. With control fully granted, the attacker is now able to infiltrate and search for any computers within the victim's internal IT network. Once the target computer of interest is found, the attacker can now use the Eternal Blue NSA exploit to attack it. As seen on your left screen, the malware is now being executed. Once it has located a file of interest, the malware is instructed to steal it and send it back to the attacker via his own fax machine. As we can see on the right, the stolen document is now being received by the attacker's own fax machine.
Here it is. How your fax machine can lead you to be hacked. Because my home HP printer, scanner, and fax is also hooked into my machine, my computer. I've since don't do that. I have it disconnected. I only connect it when I'm going to receive a fax, but you got to be careful what you get. Once again, HIPAA compliant, you need to verify where the person is and whether or not it's an adult. You can ask the child, if you think it's a child, to put a license or identification. You have to make sure the patient is appropriate for online care. Not all patients are appropriate. Get informed consent. Make sure he's in a secure environment, and have an emergency backup and a technical knowledge of what you're doing. Just real quickly, if you have a person who has serious psychiatric disorders, of course you can't treat them online. Very depressed, if it's a danger to themselves. I had a person who was unbelievable, came to me through the internet. Transgender male, who's now female, had 2 suicide attempts, and at the time was presenting as mainlining heroin. And she wanted to have treatment online. Well, of course, I couldn't do it. I sent it to a treatment center in England for detox and further care. A psychotic person, problems with reality, dangerous person, and certainly paranoid people wouldn't be appropriate either. So all the different professional organizations have ethical standards about how we need to conform to the laws of the states. Just going to show you the different organizations: the American Association of Marriage and Family Therapy, American Counseling Association, National Association of Social Workers, and the American Psychological Association. All have standards. Georgia now has requirement for anyone working online to have continuing education, okay, and use appropriate encrypted technology. 6 continuing education credits if you're going to work online. Now, I took the DCC course, which probably most of you never heard of, and it certainly doesn't do anything after my name saying Arthur Trotzky, DCC. But the course was very valuable in order to understand how to set up my program. The person who conducted the course, Deanne Nagel, is one of the top people in the country. She and Kate Anthony, who's from England, put together the course. It's in a book called Therapy Online. If you're starting out, you might want to look at that book and get the basic ideas. The only advantage of the course for me was meeting other people, especially from the VA, who were already doing online therapy. But this is a great, great resource. Ethically, we need to adhere to the ethical standards of our particular organization. Social media, okay? Very important to have a social media policy. I put two resources here where you can get a social media policy. I got mine from Dr. Becky Beaton. I think I paid $15 or $30 for it, and I had the form, very long legal document. All I had to do was put my name and my company and a couple of addresses in it. It's appropriate for my uses. So you need to get a social media policy on your website, and these are two good resources where you can get them. Just remember that anything you put online at any time is always going to be online, unless, of course, someone hacks the whole internet. So you may not want clients to see you. If this is you and you're with your husband at the Halloween party, I doubt very much that's going to help you as a professional. So be careful what you put online. This is a big question to Google and not to Google. You know, everyone who's going to a therapist, I'm sure, will Google their therapist. So you say, do I have the right to Google them? The American Counseling Association says we need to respect the privacy of clients unless given permission. But what about a young woman who's working in a clinic late at night and she suspects that her client is a predator? Is she justified in looking for anything on the internet? So these are a lot of questions. The points of view are, if he can search me or she, I can search them. I can give them an informed consent and search. And some people think it's voyeuristic and intrusive. Okay, these are the summary of the ethical issues. Be competent, be confident, confidentiality. Watch out for dual relationships. Screen your clients. Let them know about the benefits and hazards. Crisis intervention, very important. And know the laws. You're welcome to look at my website to get an idea of what the online consent to therapy is and what rights of privacy are, and the social media and how to set up a website. Cookies, I don't want to say much about them other than there are all types of cookies. These are not the ones I'm talking about today. Cookie information, this one says cookies don't collect personal information. Now look at this particular cookie explanation. And the final word is, if you need to log in, you will need to adjust your browser's privacy settings to accept cookies. So you're saying if you want to log in, if you want us to remember you, then they write, we primarily use cookies to provide you with a secure access to your account. We primarily use. That doesn't mean they don't use them to send them to insurance companies. Or, you know, I once bought mosquito netting for my dog. No. I bought mosquito netting for my doors, not dogs who's starting to bark. The next day on Facebook, it popped up, an advertisement, so I had some cookie. So be careful with cookies. Read the policies. You all know what secure socket layout is. I'm not going to waste time on that. You see it, HTTPS. Skype, number one, is not HIPAA compliant. There are too many people online. Some people say it can easily be hacked. I'm not crazy about the drop calls, the lag, the quality of the internet. This is the quality of their groups. It's also not HIPAA compliant. I use Mega Meeting. Mega Meeting has the ability to chat and move pictures around. The nice thing about when you have a program is you just send an email. If it's browser-based, you just click on my name and the meeting. This is my website. They go to my first page, the bottom, online therapy, individual therapy. They click on that. They go down to the bottom of the page, enter meeting. They click on that, and they're in the meeting. It's very easy to use, a cloud or browser-based. Today I use Zoom. I'm not going to show these films now. Maybe at the end if we have some time. I want to get to the apps. Recent conference run by SAMHSA up in New York. Mobile health apps to address opioid use disorders. Okay, it can be used now for medically assisted treatment and to address the use in treatment, efficacy, and the aftercare or continuing care. Sierra Tucson in 2005 opened a program called Connect 365. It's terrific. I know people that have used it. They offered it no additional cost when they leave the treatment. Most people leave treatment and they just, goodbye, good luck. You have a therapist, good, go to therapy, go to meetings, come to our alumni meeting at the swimming pool in the spring. However, this program connects for free for 1 full year, no cost, HIPAA compliant. They give you a personal Sierra Tucson recovery coach, interactive problem. They have a support team that is also involved, so they see what's going on. It gives you support, meeting logs, personal accountability, and progress reports. It can also be used for licensing boards. It just gives you an idea of how many live monthly contacts with the recovery coach, 1,200 with 6 recovery coaches 1 month. So you see the people use it. 72% were adhering to their plan, 86% participated, and 78% had an improved quality of life. You can monitor that, see the improved quality of life. Also, if you see somebody in trouble, readmissions. It's not only valuable to save a life here, but they continue to have income for their treatment facility and save a life at the same time. Touchstone Circle of Support is Hope Homes Recovery Services. They use this in Tennessee, North Carolina, and Atlanta. You sign up and you add significant people to your accountability network. So every day when you log in or when they contact you, you tell them when you're having cravings, whether you go to a meeting, and they can see this. And they can also, so if you're a husband and your wife is in treatment, she's just released, you don't have to keep questioning her. You can just, if she puts you on her app, you can see what's going on. This is what Beth Fisher-Sanders, the founder and director, says about it. We can extend our staff's ability to support and monitor our residents' ongoing recovery. The application allows us to create an accountability network outside the walls of the residences. These are people who have completed treatment programs and now in sober living. Now they have a continued care of support. The circle of support share their daily victories, such as overcoming impulses, triggers, impulses to renew addiction-related behaviors, and they give encouragement that reinforces the recovery journey. So that's a pretty good program. It comes on laptops, tablets, and cell phone. By the way, I do not recommend using cell phones or Android smartphones for therapy online. It's too small of a screen to be effective for them and for us. You need to have a little bit of larger picture of the person you're working with. This is what it looks like. And Hope Homes can now request a urine test, which is done in the presence of one of the support team. And they have emojis, which is nice. It's like getting similar likes on Facebook. Those 3 emojis I put up on this slide to show you how I was feeling in early recovery. By the way, let me mention at the end of the webinar, there will be an evaluation, 4 or 5 questions. Please take the post-webinar questionnaire. Appreciate it. Let's go on. Summit Behavioral Health Care, in many of their treatment facilities, are using a program called Track 9. It analyzes the behavior of the patients, what's going on with them, with a huge pool of others in treatment. So you know what's going on. It's Joint Commission and accredited and joint and HIPAA compliant. It monitors the client's real-time progress. It alerts the treatment team on symptoms. It gives the clinical director the ability to monitor care. So, and if something's going wrong, they can get an email saying, the algorithm is indicating that such and such patient is high risk of leaving AMA, and they give a recommendation. The program I'm working with in Israel, this is it. It's you can see at the top, since you don't read Hebrew most likely or Arabic, it says Municipality of Jerusalem, Division of High Risk Youth. It's called Kidum Noar, or Advancement of Youth. And the program at the bottom there is called Mane Bereshet, Answering Online. And this is their Facebook chat. These people on the left on Monday, 2 people called in, one on the top, and you can see how the blue is the counselor responding. And that's a chat that's available every night to kids that are having tough problems, and they use it. It's also in Arabic, and they use the messenger aspect of Facebook to respond to the clients who call in. These are youth, and they advertise also on Facebook. They're using social media to get to kids who are having problems. As you can probably see in the 2 top, they're probably talking about kids who are having tough times. I don't know what the bottom one says because I don't read Arabic, but it's probably saying, do you have to keep a smiley face when you're suffering? The Hebrew ones are also for the Hebrew-speaking population. The bottom one says, if you're bullying, turn to us. Violence is not violence. Violence is also violence through the computer. I want you to Google this and look at the projections for what the internet's going to look like in our lives in 2025 and 2025. This was something from 1999. The predictions 20 years ago. We're going to have fax machines, word processors, answering machines. When was the last time you checked your answering machine? Enhancement of test administration, scoring, interpretation. Use of telephone for therapy, email, and chat rooms. They never anticipated what we're having. So take a look at that. Now that I have a second, I just want to show you, before I go to questions and answers, I want to show you a quick video to show the difference between gallery view. I use a program called Zoom today. Okay, I asked Art if he would come in one-to-one just to show you how the one-to-one looks. This is called the gallery view. I can also put it into speaker view, which will show Art as the full. I don't like this, but it's your preference as a therapist, what you prefer. I prefer to have 2 pictures, one next to the other. And Art is not using earphones. Alan, can you say something so you can hear how it works without the earphones?
Arthur, how you doing? Just out here working.
Yeah. See, it's perfect. But as I say, if he were at home and he were talking about problems, let's say his spouse or his friends, you wouldn't want that conversation to come out of the speakers. So that's how the one-to-one looks. Once again, this is the speaker view. Now, what Art is seeing, he's seeing me full screen, right? Is that correct?
Yes, I see you full screen.
So if you want to see the client full screen, you want to use the speaker view. But the problem is he would see me, and I prefer to see exactly what he's doing all the time in myself. Plus, I like the idea that we're both equal.
Mm-hmm.
Okay, well, thanks again, Art. I appreciate it. Another problem with the speaker view, especially if you're doing groups. If you're doing groups, the speaker view, whoever's speaking is going to pop up. The problem is if you have 8 people popping up, sometimes they both speak, only one pops up, it'll drive you crazy. I recommend Zoom. It's a terrific program, very clear. They don't necessarily use email. They don't necessarily use earphones and mic, but I recommend it. Okay, I have a question from Audrey who asks about coaching across state lines. Now, that's a great question because coaches don't have to abide by the laws of the professional organizations. They're not psychologists, they're not counselors, they're not social workers. So they can do what they want. However, here's the danger. If you are a psychologist or a counselor or a social worker or another professional, and you're saying you're doing coaching, that's a violation. If you have a license in your state as a professional, you can do coaching, but you have to still abide by the laws that your state is requiring you to abide by, and that your ethics committee wants you to abide by. So I don't have any more questions. I just want to mention again, Person-Centered Tech is the greatest website for finding out about information about all these HIPAA compliant stuff. Roy Huggins is the man to look up. And I think I've covered most of the material I wanted to. I had to speak real fast and I'm exhausted. And I want to thank my little doggy who's right here with me for not barking. Say good night. Okay. Thank you very much for attending the C4 webinars, and I wish you all the best. If you have any questions, email me. Have a good one.